everybody. So today I'm going to introduce medicinal chemistry to you, talk to you a little bit about some of the types of tests that are done to make a drug safe, also some of the key terms that you need to know about dosages. So let's talk about classifications of drugs. First of all, how are they actually classified? And generally, they're classified based on their mode of action. So you'll see that we'll be talking about some drugs that are painkillers, and how they act depends on what type of receptor in the brain they would actually bind to. And so that will actually affect how potent the drug is. We'll talk about other drugs that are minor painkillers and what receptors they bind to. Also talk about antibiotics, as well as antiviral drugs, and you'll see there's a whole slew of classifications, different classifications of drugs. We'll also talk about, ways to administer drugs. And so one of the ways is actually orally. So this, you would just take the drug and swallow it. There's also IV, so intravenously. You could take it cutaneously. And so cutaneously, that is like an ointment. It's something that you would put on your skin. A patch would actually be transdermal. So in this case, the patch is whatever medicine is on the patch. It's absorbed by the skin, and then it enters your body. There's also inhalation. And so if you inhale a particular drug, like a lot of the new Flonase anti-histamine drugs, those are done through inhalation. And also there are, so inhalation is another way, that's with Flonase and other antihistamines, anti-asthma drugs as well. Those could also cause or be taken through inhalation. So these are just some of the ways to administer a drug, and you should be familiar with them in case they mention them on the IB exam. Sometimes when they're testing a drug, they'll look at the therapeutic effects versus the placebo effects. And you might have heard this term, in passing throughout your life. A placebo is basically a control. And they would give that patient either something like a sugar pill, or they would administer something, if it was, IV, they would use saline. So now they're like, the patient who's part of a trial to test a drug, they may think that they're getting this compound, but in reality they're not. When you do an experiment like this and you're testing a drug, you want to do something called a double-blind experiment. And a double-blind experiment, the purpose really is to keep the researcher and the patient in the dark about whether or not they are getting the sugar pill, or whether they are getting the saline, or whether they're getting the real therapeutic agent. So, like a researcher, they will, the best experiment that they could do would be one in which they don't know if the patient is receiving the medication or not. So how do we get a drug to, patients? Where does it start? And if we go, like all the way back to the beginning, the inception of finding a new drug, usually it starts with some kind of lead compound. So you have to have some kind of new chemical entity, they call it an NCE. And this compound, they don't know if it's going to be, efficacious or not, but they, will try it based on, maybe they tested it on cells, maybe they, tested it, on bacteria to see if it would kill the bacteria. And from there, they can take this new chemical entity and test it further. Another way of, like getting an effective drug is large-scale drug screening. And this approach is sort of like throw everything you got at a particular disease. So they could be growing many, many cells in culture, many replicants, thousands and thousands, and they could be applying different compounds, these new chemical entities that they find just across the board, and they'll do thousands and thousands of trials. Now, this large-scale drug screening is usually done by machine, and if they find a compound that seems promising, they'll take that compound out, and researchers will test it further. But this doesn't always yield great results. It sometimes is just you're trying thousands of compounds and none of them seem to work well. The other way is rational drug design. And so rational drug design, I happen to really like and think that it is the best way to go if you can do it. And that's where you would take some kind of existing drug and you would change one of its functional groups. And by changing one of the functional groups, maybe adding a chlorine where there wasn't one, that could have a huge effect on how useful the drug is. So, when they go through this, whether they're doing rational drug design, whether they're doing a large-scale drug screening, they'll test the drug activity in cells. They'll do preclinical trials, which would normally be in some kind of animal system. So they would test it on rats or mice. And then they would test it clinically in clinical trials. Clinical trials would be with humans. And when we look at, what does this look like? There are 3 phases to the clinical trials. First, they'll start with a small number of volunteers. And this, they're just trying to figure out what's known as the toxicity dose, the TD50. In humans, they don't really have a lethal dose. It would be unethical. And some people would think also with animals, but they use a lethal dose in animals. They will not use a lethal dose in humans. I'll define what a toxic dose 50 is in a minute. They test for side effects, and if it seems like the drug is relatively safe and like there's not a lot of side effects, then they'll go further. So the first stage is this small stage, and then they'll move to and the next stage where they'll have actual patients. So a difference between phase 1 and phase 2 is in phase 1 it's generally healthy volunteers. They're just making sure that the drug really isn't that toxic. And then they'll use a small number of patients, and with the patients they're looking to see if the drug is actually effective, and they're testing again for safety and side effects. And then before the drug would go to market, they would do a large-scale type of phase trial, a phase 3. And they would do this to compare to other drugs that are on the market. They would see if it interacts with other drugs and causes side effects that they might not think about. And they would try and get a large amount of data. You may hear on the radio or on TV, there's always sort of like an ad for some kind of medication, and then at the end, with the happy people running by and everything, they list off all the possible side effects. And you may also see on TV how they, or sometimes have lawyers that are, saying, have you taken this drug? And if you did, you could be, it could be possible for you to, get money if you took this drug because it's harmful. So, even though people go through the process of testing large amounts of patients in order to make sure that the drug is safe, there's still the issue and the possibility that it is not. So let's talk about the drug property considerations that you need to understand. One of them is tolerance. And so this is where after you regularly take a drug, your body sort of reduces its response. So the body has a reduced response. This happens a lot with narcotics. So people who are addicted to heroin, they need to take more and more, higher doses in order to get that same effect. And the real problem is that this could lead to toxicity. That's what basically an overdose is. Effectiveness, this depends on a whole bunch of things, but really it depends on something called bioavailability. So for example, if I were to take a drug orally, so a drug orally, taking that drug, my stomach may digest it. So this may be rendered ineffective by stomach acid. A lot of times, especially for migraine headaches, they'll have a form of the drug that you can take with a needle. So you could, inject yourself with the drug, and it will bypass the digestion in the stomach. If you're nauseous and you can't take the drug that way because you may throw it up, you may have to take it intravenously. Generally, if you were to take a drug intravenously, it's always going to have a higher effectiveness. And then the last thing to consider is addictiveness, side effects. So, an addictiveness, it's defined as a compulsive desire to take the drug, even if it's dangerous. So a compulsive desire to take drug despite adverse effects. And so, when somebody's addicted to a drug, for whatever reason, they'll still take that even though it's dangerous for them. So when we do dosages, the three terms you need to know: lethal dose 50, effective dose 50, toxic dose 50. And they're all talking about 50%. So the lethal dose is the dosage that will kill 50% of animals. Now, they don't do lethal dosage for humans, they'll do it on animals. They'll do toxic dose 50 in humans, and that's, causes 50% toxicity in humans. And effective dose 50, that would be, gives you the desired effect in 50% of the population. Normally, dosage is in something like milligrams per kilogram of body weight. So let's talk about the therapeutic index, which relates these terms. And the therapeutic index, it is the lethal dose 50 or the toxic dose 50, depending on if it's animals or humans, over the effective dose 50. And so let's say, for example, that you had a lethal dose of 100 milligrams per kilogram, and you had an effective dose of 1 milligram per kilogram. So that would be a large difference, and that leads to something called the therapeutic index and window. And when we look at the therapeutic index and the therapeutic window, we want to get sort of like a large effect for this and a large window of dosages. So take, for example, here, if we were to look at the effective dose 50, 50% of patients affected. As we increase the dosage and we compare that to the toxic dose 50, we can see that they're relatively far apart from one another. And so the chances of them having some kind of adverse effect from this drug is slim. If we were to push these closer together, that therapeutic index would be much lower. The therapeutic window here, this is, patients affected percentage. So, if we can get 100% of patients affected in a safe range, that will actually be something really great. If there's this overlap between the toxic dose and the effective dose, then you end up where the drug will not be considered safe. So I'm going to stop here for now, and this is what you're going to watch over the break, and when you come back, then we'll talk about this particular video, and we'll go on from there. Thanks.